Nikki S. had been dealing with chronic migraines for years, and after a train accident in 2016, her symptoms became even more severe. She experienced constant head pain, light sensitivity, and other debilitating symptoms. Her social and work life suffered, and she felt dismissed by those around her who didn't understand the severity of her condition. Standard treatments and home remedies had not provided lasting relief, so she reluctantly decided to try ketamine as a last resort. Nikki's experience with ketamine for her migraines was life-changing. After a 5-day infusion in the hospital, she found that her most significant migraine symptoms were controlled for 3 to 4 months. Not only did it help with her symptoms, but it also made it easier to manage the symptoms she did have. Dr. Stephanie J. Nahas, a neurology professor at Thomas Jefferson University, has seen similar results in other patients. Some even experience up to 9 months of relief after the 5-day infusion. However, she cautions that ketamine is not suitable for all migraine patients, especially those with certain medical histories. At Jefferson, ketamine is only used for patients with severe migraines and multiple failed treatments. Dr. Nahas is also wary of other delivery methods like oral and intranasal, as they carry more risks and have not been as effective in their experience. For Nikki, the outpatient form of ketamine helped during severe migraine attacks, but it was the 5-day infusion that made the biggest difference. She found that nothing else provided relief for such an extended period. Ketamine is a complex medication with high abuse potential and is a controlled substance. It can be difficult to use, and an overdose could lead to loss of consciousness, liver and spinal cord damage, and potentially brain damage. Even with correct use, it can cause serious side effects such as intoxication, nausea, sleepiness, visual disturbances, mood changes, hallucinations, out-of-body experiences, and paranoia. Studies on ketamine for migraine are limited and conflicting, as it cannot be studied with the gold standard for clinical trials. Dr. Cohen believes it is suitable for some patients, but it needs to be studied more thoroughly to understand the risks and benefits. Despite the risks, for some patients, the potential benefits outweigh the risks. Nikki has experienced a significant improvement with ketamine for her migraines. She is now back in school studying to become a nurse, inspired by her own experience as a migraine patient. Nikki values the extra time and effort that some providers put into listening to her and providing validation and understanding, and she wants to bring that same kind of care to others as a nurse.